Many more Americans could soon be vaccinated against the coronavirus. The FDA has authorized Moderna's vaccine for emergency use. It's now the second vaccine available for use in the United States. 6 million new doses will be shipped across the country beginning on Sunday. A recent article in The Atlantic calls the next 6 months, quote, vaccine purgatory. It describes how this time period after vaccines are approved could be strange and confusing, especially while some people are vaccinated, many others have to wait. The author of that article, Sarah Zhang, is a staff writer at The Atlantic. She joins us now. Sarah, your article calls this time period vaccine purgatory. Tell us a little bit more about why you're calling it that.
Yeah, that's right. So, we spent kind of the past year kind of adjusting to what, living in the pandemic looks like, right? We've adjusted to this new pandemic normal. And over the next 6 months, we're going to go through this maybe longer, actually. We'll be going through this long period where some people are getting vaccinated, some people are still waiting. The rules of what you're supposed to do might kind of be in flux. So we're just going to be going through, and, we don't really know exactly how long it will take, who will get it. These are things that are still kind of up in the air. So I think I just wanted everyone to get a sense of what the next few months will look like. There will be a lot of unanswered questions currently, but we'll get those answers eventually, and eventually at some point we'll all get vaccinated.
Eventually. There's a lot of, I think this whole pandemic has had a lot of, it's going to come eventually. We're going to learn eventually. We just have to be patient. And in your report, you actually point out that we don't know how long this purgatory period is going to last. What's the latest guidance or estimate for when the average American is likely going to get the vaccine?
Yeah, so Operation Warp Speed has kind of put out a timeline saying that maybe we can start vaccinating sort of everyone who's not in a priority population by April and May, and by June, hopefully, most people who want the vaccine will get it. The sort of really big bottleneck is really just, do we have enough doses of the vaccine, right? And so, first of all, we have 2 really great vaccines right now that have been authorized by the FDA. That's really wonderful. But these are also 2 new vaccines that are kind of being made for the first time. And they're also a new type of vaccine that are being made for the first time. We've already seen that even this week, states were getting confused about exactly how many doses you're going to get next week. And the number of people who are probably going to get vaccinated this year, the estimate has gone down from 20 million to 10 million. So should we really expect that there'll be a few more of these little hiccups, just because this is a new process and also a very complex and big process at the same time. The other question that's up in the air is just that will there be other vaccines that are authorized? It seems likely that AstraZeneca's might be over the next coming months, possibly Johnson & Johnson's once we get the results. And so the more number of vaccines we have on the market, also the more quickly we can get the actual doses to people. The really kind of big unanswered question is, do we have that number of doses? And
right. But I think that that's a really important point, that other vaccines might be on the horizon. And right now, obviously, our country is vaccinating healthcare workers and long-term care residents. But after that, do we know anything more about who will be vaccinated next? What is the next category of frontline workers? Is it going to be people who are making deliveries, people who work in supermarkets, teachers, or will it be opened up based off of age groups or health risks? Do you know anything more about that?
Yeah, that's a great question. So the recommendations are set by a CDC advisory committee, and we don't have any firm guidelines yet, but the very likely recommendation will be that the next group will be essential workers. Now, who are essential workers, as you were asking? Well, that's up to the state. The details of that are up to the states, right? So I think it could be very likely that maybe one state decides to go one way and the neighboring state decides to go the other way. For example, maybe one state decides teachers should be first, and maybe another state decides, well, maybe we actually want people who are working in food and agriculture to be first. There will probably be some inconsistency, right? And this is meant to be like a local process, because we kind of want every state to kind of survey their own state and their own population and decide what's best for them. But what it means is that it might be a little frustrating, because it might be like, well, I qualify in this state, why not in my state? And I think that's just going to be a little bit part of the process, is that it will take a long time to get it to everyone. A lot of different groups will have some claim to priority, but you, by definition, cannot prioritize everyone.
Yeah, it is. It is interesting how decentralized a lot of this has been. So we're less than a week away from Christmas, and General Perna compared it to a football game with the vaccine as offense, but said that a game isn't won without a strong defense. And in the case of this analogy, that would be masks, hand washing, and social distancing. Do you worry that people are going to let down their defenses?
I don't, and that's simply because I think most people aren't getting the vaccine yet. I think the vaccine is not going to radically change any normal American's life this year. I think General Perna's metaphor is a great one. Another way to think about it is that vaccines are not an off switch, but maybe listeners have heard like the Swiss cheese metaphor, right? Like maybe you can have many kind of imperfect slices of cheese that have holes in them, and each slice of cheese might be masking or might be social distancing, and each one is imperfect, but when you put them all together, they can really drastically reduce your risk. And vaccines at this point are really just another slice of cheese because not everyone's going to get them. But eventually we'll get there. It will take some time. It might take a little longer than we want, but we'll get there.
Very encouraging overall, your article, even as you're talking about Purgatory, because you have some additional reporting on the vaccine side effects that I'm hoping you can talk about. You say while some people may feel sick, it's actually the immune system working. Can you explain this for us before we say goodbye?
Yeah, of course. So what vaccines do is that they trick your body into thinking it's been infected, right? So basically your body will, like when you start to get a cold, you'll feel kind of achy and sore, perhaps. You might get a fever, you might get a headache. And that's actually just what your immune system does when it thinks that there's a foreign invader. But this vaccine, it doesn't actually contain a virus. It can't actually make you sick. What you're really feeling is just your immune system working. And that those symptoms, you might not feel great for a day or two, but they will go away.
That is very encouraging. All right, Sarah, thank you so much for joining us.
All right, thank you for having me.